everyone. Welcome. I want to introduce myself briefly. I am the Healthy Comprehensive Planning Coordinator with TerraSoma. TerraSoma is a strategic service firm with a specialty in food systems, and I am probably the newest member to the Food Access Planning Guide team. I'm very proud to be here today with you all. Prior to making this move, I served as the Program Director for Gardening Matters, which is an organization that focuses on community organizing and urban agriculture policy. I also currently serve on the St. Paul Ramsey County Food and Nutrition Commission as the chair, and I have been working on changing policies to support urban agriculture and food access at the state and local levels for probably around 6 years now. So I am really excited to join you today. I'd like to briefly introduce our other panelists who will be speaking a little bit later in the presentation. Adam Altenburg is a Community Transportation Analyst for the Fargo-Moorhead Metropolitan Council of Governments. He works closely on a variety of community planning, transportation, transit, and food system issues affecting the Fargo-Moorhead metropolitan area, and I am really excited to hear him talk more about the Clay County Food Systems Advisory Council. And then Matt Lakeman, who currently serves as the Community Development Director for the City of St. Cloud, administering the planning and zoning, health and inspections, economic development, and building permitting activities for the city. He has previously served as the Planning and Zoning Administrator for the City of Moorhead and as a Planning Assistant with the City of Mankato. So he brings to us a wealth of experience, and he holds a master's degree in urban studies and a bachelor's degree in geography and urban planning from Minnesota State University, Mankato. So welcome, Matt and Adam. I'm so happy that you're able to be with us here on the call today. Let's talk a little bit about our goals for our time together today before we get started. This is a very exciting day for the Minnesota Food Charter Food Access Planning Guide team. This document has been in the planning and drafting phases for a long time, and we are very proud to launch it in this webinar today. We will learn today how and why this guide was created. We're going to take a sneak peek inside to see what it does and how to use it. The guide provides tools, resources, proven policy strategies, and recommended language for comprehensive plans so planners and community food advocates can collaborate together to design communities that promote healthy, safe, and affordable food. We will also hear from the case studies from our special guests, so you can take away specific examples from both City of St. Cloud and the Fargo-Moorhead area on how the food access improvement strategies are being incorporated into current comprehensive planning processes. And then finally, we will talk about additional resources that accompany the Food Access Planning Guide to help you utilize it further in your work. So yes, there's the Food Access Planning Guide, and then there's more. Move on. I want to take a minute and talk a little bit about equity as an important foundation for all of this work. We know that living conditions contribute directly to our health outcomes in our communities, and these factors are known as the social determinants of health. They include things like economic stability, education, social and community context, healthcare access, and quality of the built environment. Healthy food access was specifically identified as a social determinant of health by the U.S. Department of Health and Human Services. And one promising way to address the complex social determinants of health is to apply what we call a health in all policies framework. As you can tell from its name, the goal of a health in all policies approach is to reduce health disparities by framing the health of individuals and communities as the central goal of government policies. By adopting a health in all policies approach, the Food Access Planning Guide is one of the ways that Minnesotans are responding to health disparities and social factors that disproportionately affect some communities in our state. The Food Access Planning Guide adopts an equity lens, and all of the strategies in the Food Access Planning Guide are designed to advance equity for all. All right, before we dive in, I would like to take a minute and to see who is in our virtual room today. For me, webinars can sometimes be an isolating experience, just me and my computer screen and a faraway voice. Hopefully I don't sound that far away to you. But I want everyone to know that you are in a virtual room today with over 100 peers who all care about improving our food environments. We are building a network here, a great team, and we are building knowledge, connections, and power for change. So I hope that you feel that as you sit in your chair and look at your computer screen and listen to my voice, and that you feel that you have a really important role to play. I'm going to have Cam open up our poll. Question number 1, who is in the room today? Can you please select the category that best describes your role? We tried to brainstorm an inclusive list of people who might be with us today, and we'll take a look at who might be in the room in just 1 second. We have about 10 seconds left if you're answering the question. Thank you for your patience. This is our first time, my first time at least, trying the polling on WebEx. So,
it's about 10 seconds.
About 10 seconds left. All right. So you can see from the screen we have a number of public health representatives, we have a number of nonprofit representatives, university extension, healthcare, so a wide variety of people on the call today, thank you. And we have one other question. What we'll do is we'll ask you to answer this question and we may go back to the results a little bit later in the presentation. The question is, please describe your comfort level with understanding how strategies to improve food environments could be included in a comprehensive plan. And if you could take a couple seconds and let me know how you're feeling today about this topic, we'll go back and take a look once we get all the responses. We'll just take a couple more minutes. All right, I feel like we need a drum roll for this slide here. You can see the Food Access Planning Guide well, this is the food charter, the Food Access Planning Guide picture was coming. Okay, we're going to take a minute to talk about the food charter first. The Minnesota Food Charter is a document we hope you are all becoming very familiar with. In fact, some of you may have been involved in its creation. The Minnesota Food Charter was developed through a broad-based public process. And what it does is offer a shared roadmap for how all Minnesotans can have reliable access to nutritious, affordable, safe food in all of the places that they work, live, and play. It was created so that people can work together on shared strategies to increase healthy food access for all. In the Food Charter, you will find 99 strategies that focus on changing policies and systems so the healthy choice is the easiest choice for everyone. These strategies aim to reduce the risk of cost of obesity and diet-related diseases like diabetes and heart disease. It is also aimed to conserve our state's resources and boost our economic prosperity. We are in good company with the Minnesota Food Charter. We are following the lead of 4 other states, including Iowa, Michigan, Oregon, and West Virginia. The Minnesota Department of Health took the initiative to develop the Food Charter, and then the combined effort of hundreds of organizations, a number of state agencies, the University of Minnesota, Minnesota companies, the Center for Prevention at Blue Cross and Blue Shield of Minnesota, public sector groups like local governments and regional agencies, and thousands of Minnesotans have made this document a reality through careful input. So, okay, now the drum roll. The Minnesota Food Charter Food Access Planning Guide. This is one of several topic guides that has been introduced to help people work on specific strategies in more focused ways. This guide will empower planners and healthy food advocates to work together on policies to improve our food environment. The guide provides tools, it provides resources, it provides proven policy strategies, and importantly, it provides recommended planning and zoning language for comprehensive plans. When planners and healthy food advocates include policies from this guide in our community's comprehensive plan, you will be designing communities that promote access to healthy, safe, and affordable food. I want to talk a little bit about the importance of the partnership between planners and healthy food advocates. Planners and healthy food advocates share ability, interest, and people power to ensure our communities are equitable, healthy, prosperous places to live. Planners out there, you play an important role in identifying existing health, equity, and access disparities, and using comprehensive plans as a way to shape a community's food environment to support healthy eating. And healthy food advocates, you understand the needs and priorities of your community when it comes to healthy food advocates. So this guide was developed by a diverse group of planners and advocates with insight and expertise across the entire food system in the state of Minnesota. The group has come together and been working for a number of months to prioritize the most promising strategies and policies that make sense for our state. So with this guide, it is now going to all be at your fingertips. Let's talk a little bit, before we go too much further, about why we need a food access planning guide. We know that our state is stronger when everyone has access to opportunities for health, security, prosperity, and quality of life. But we also know, and it becomes clearer and clearer every day, that in Minnesota we face some really serious issues with reliable access to safe, affordable, healthy food in every community. From our very small towns to our tribal communities, to our suburban and more densely populated urban areas, there are a lot of Minnesotans who don't have the resources to purchase or get to affordable, healthy food. We also have the fourth largest grocery gap in the nation. It's not easy for Minnesotans to get to full-service grocery stores in some areas. This translates into a higher rates of obesity and diet-related chronic disease, and those can cost billions per year in healthcare costs and lost productivity. So when we are creating healthy food environments and healthy food infrastructure, we are going a long way in reducing rates of preventable diseases, improving the health of our population, fostering communities, and creating economic development, and achieving equity. This is where planners, healthy food advocates, and this guide are a great combination, because we can address these challenges together by including healthy food-focused policies and strategies in our comprehensive planning efforts. So I'd like to just take a second and vision for a minute. If you can vision, as you sit there in front of your computer screen, your community right now in 2016. I'd like you to just close your eyes and see your community in your head, and fast forward 12 years, 2028. The children that are 10 right now will be young adults at age 22. What do you see in the next 12 years that will change in your community in that time period? Across the state, local governments are planning for all of these changes, and community advocates are guiding the processes along the way. In the metro area, communities are working to write their comprehensive plans for 2018 to 2028. The Met Council has recognized the importance of food systems in planning, and in this guide, you can find planning resources from the Metropolitan Council, including the Thrive 2040 plan, the local government handbook from the Metropolitan Council, and other planning tools. The inclusion of food in the Metropolitan Council handbook is not insignificant. Many advocates worked when the Thrive 2040 plan was being developed to ensure that food systems were included in the planning priorities. And through communities outside the 7-county metro area, planning in food systems is also occurring. Though these communities aren't legally required to create comprehensive plans, most have some sort of plan, and many are currently going through similar planning processes. Our two guests today are both outside the 7-county metro area, and they will talk a little bit more about their efforts. And each region in our state has a regional development corporation that assists in the funding in Greater Minnesota. More and more funders in Greater Minnesota are tying funding streams to planning processes, and planning processes can be very powerful in Greater Minnesota also to ensure the access to safe, healthy, and affordable food. Okay, so here's the first page, the table of contents. Let's take a peek. This guide is organized from a planning approach, and the organization should be familiar to planners. The topics are also organized so planners and advocates can easily see how the comprehensive plan can impact food environments and help to identify a community's priorities in the guide. The guide itself is divided into two sections, learn and act. We need policies and plans that create environments for healthy food access. Planning in this way requires a comprehensive approach, one that spans the entire food supply with many partners, sectors, and agendas. And to ensure success, planners and partners will be emphasizing policy, systems, environmental changes, both learning and acting. The two sections will offer a rich array of resources, information, and case studies that can help everyone understand the whys and hows of healthy food access and how it relates to comprehensive plans. For healthy food advocates, there is a ton of useful information to help you work with planners to make lasting changes in your communities that promote health and equity for everyone that lives in your community. You can see that the guide offers an open resource and idea menu. It is designed to be flexible so that you can take language directly from the guide and you can adapt it in any way that appropriately fits your community. There is a very handy chart available in the guide that outlines both the process of comprehensive planning and the role that different people play in the planning process. Comprehensive planning may seem complicated to those not familiar with the process, but this is a wonderful visual that outlines the process in a lot of different ways. It's important to note in this chart, if you look at it carefully when you get a print copy, I know it's hard to read the screenshot, that the comprehensive planning and advocating process simply lays the foundation for healthy policy change, but the work doesn't stop with the plan. Once the plan is adopted, there is more work to be done, and everyone plays a critical role in making sure that the plan is implemented and that changes are measured and followed through. If you look at the next screenshot, you'll see that the second section offers an array of effective strategies and policy language for healthy food access that correspond to more traditional chapters of a comprehensive plan. It also includes topics related to healthy food access that can either be included in traditional chapters or serve as standalone chapters or be integrated in both and way. The chapters encompass land use, housing, transportation, and economic development, and also farmland preservation, food production, pollinator health, food aggregation, processing and distribution, and healthy food retail. And you'll see that the guide offers flexible options and how you can incorporate those different strategies. You can see here that there are some icons that you can follow If you look at the next slide, which is our example, on land use, you'll see the icons at the top of the page that indicate the different places this language might be included into a plan itself. So I wanted to take a second to just briefly look at one example and the kinds of information you'll find in the guide. You have a goal statement, you have an overview of the topic, and then you have sample policy language, suggested implementation or action steps, and things to consider, the pros and cons of different approaches, and the fact that this is not a one-size-all approach, but something that you can adapt to your community for a wide range of general or more detailed plans. Now I'm going to turn it over to Matt Lakeman from the City of St. Cloud to talk to us more about the food system and planning work that St. Cloud has been involved in. Take it away, Matt.
Thank you, Nadia. It's really those last couple of slides that I think really drive home the point and the reason why I've agreed to be on this webinar today. Those are really learning pieces as we as planners have been dabbling for the last 20 years or more. In my case, just approaching 25 years. We've done comprehensive planning the usual way, and not all of the modern topics or issues of the day have been included in that process. And I think the guide itself is really a good tool to inject not only the process and the importance of comprehensive planning, but some of that data that goes along with why it's important to get into the process and to the early thinking of decision makers, whether it's planning commission, maybe it's a study committee, maybe it's your city council members who ultimately have that vote. So as I said, I've been doing this for about 25 years now. I've done comprehensive plans near Mankato for a number of various sizes of cities, small and large. I've done a plan in Moorhead about 20 years ago, and two here in St. Cloud now, one in 2003, and just recently here adopting another one. And as was introduced, this really is an important document. It's the policy document. It isn't necessarily the tool that really gives the city council the action step or casts the final vote on that action step, but it gets in their thinking and it gets it on a list of to-dos, if you will, so that as annual work plans are developed, that these topics are still in the forefront of decision makers and which come forward first. So with that, I have had the opportunity over the last comprehensive plan here in the last 2 years to really get more involved in and understand more the whole topic of food access and just public health in general as we've gone through the process. And really think we have a comprehensive plan that maybe isn't the ideal example at this point, but it's one that is a good example of how comprehensive planning and advocates and experts can really band together on this topic and really get it in the front of decision makers as we go forward. So that introduction, I'll just talk a bit about some of our experiences and why I think we've come a bit of the ways, not all the way again, but a bit of the ways to having a good example of what a plan can look like. So with that, I haven't included all the slides here. I just want to give you a real overview of some of the process and how it was injected, the topics were injected, and then the next slide talk a bit about how the document actually incorporates recommendations and language coming through the guide and other discussions that we've had with experts. So this slide, again, we've adopted our plan March 2016. We've engaged hundreds of people, if not thousands of people, and bringing in experts, community stakeholders, advocates, a wide range of people. And that's really the beauty of the comprehensive plan, is that it takes any number of issues, hundreds or thousands of issues, and puts them on the radar screen for city government. And with that, it really did start with early involvement of experts. City Hall can't be everything. We don't have all the data. We don't have all the arguments. So obviously engagement is very important in any planning process. The first thing we were really fortunate to have in St. Cloud was an active health system with CentraCare Health Systems who brought us some data. 25 years ago, we didn't have geographic information systems, although they were in their infancy at the time. Now we do have detailed information, detailed systems that we can share that kind of information. And that was one of the early creative steps that was taken in partnership with CentraCare, was the opportunity to utilize their GIS data at the appropriate geography. So we didn't know personal data, but we had enough that we could make community-wide planning decisions based upon what they knew about the health of our residents on the east side of town or the west side of town, or the south side of town. And that was really an opportunity for us. And not only through that partnership did we have that data, there were even tours going on hosted by Centercare to talk about the issues, taking folks through the opportunities in each of those geographic levels or neighborhoods. So that was really a unique opportunity, and if you do have that same opportunity, I would encourage you to do it because it really was a good piece of information to set the table for why land use planning, whether that's in roadway systems or complete streets, park systems, or even zoning decisions about food access, that there is a correlation here between the two. And the second recommendation I have, and I think was a success of our process, was that we did involve experts in that. Of course, it's good to have the data, but to just have an understanding of what the best practices are out there. Like the guide itself, it really does put forth that expertise. And then we engaged public health officials from our counties into that discussion. They weren't necessarily familiar with our comprehensive plan or what a comprehensive plan was. I wasn't necessarily aware of all the details of food access or public health principles. So I think some of those early meetings were just straightforward discussions that we're both learning as we go about each other's topics and subject matter. And that was really helpful, as you might have that discussion with any number of people, whether they're ecologists or environmentalists or recreational advocates in your community. Make sure that you inject that kind of expertise on public health and food access into your discussions early on, because it really was helpful for us. And having a document like the guide itself is really, an important piece of that discussion. If you can't make that connection for any number of reasons with an individual, and you just can't get into the details of recommendations, that you'd have that opportunity to pass on a document, whether you're doing that in-house as a city staff, or you're doing that with a consultant. And in our case, we were using a consultant that was well-versed already in those kinds of public health and food access issues. So we were really in a good spot, but the guide was useful for me as we went into the drafting process. And then the fourth recommendation I would have is really the opportunity to review the draft. After you've had that early discussion with the public health experts and other experts out there, that you go back with the draft language and you ask for comment and suggestions. And as you heard in the guide, you actually do have recommended language and strategies. So it really is a useful document in that we talk about learning early on and then acting as the second step in that process. And that's what we were doing going through our comprehensive plan. We were learning early on through those early steps of GIS and data, talking with experts, looking at the guide and understanding the context of the question in relation to whether it's transportation or economic development, and then on the back end really taking advantage of that relationship that's been built. So some just recommendations and brief overview of our process and how I think we had some early successes and late successes going through our process. Then the last slide I want to give to the group here is really just an example of one way in which we incorporate it. And this is a fuzzy slide, and I only put that in the slide presentation here, so you do go to our comprehensive plan. You can't read all of the text here, but hopefully you do go to our comprehensive plan. You can see some of the different ways that we actually did incorporate the language and the ideals into the document. But you do see this is one of the more substantive pages where we did talk about the issue. Again, we talk about public health through a large part of the page here, but we do talk specifically about food access and talk about why it's important and acknowledge the fact that we do have those issues occurring in our community. So with that, I'd just like to talk about some of the other pages so that as you might go to our document and look through it, you'll be able to take a closer look. One of the early parts of any comprehensive plan is talking about the vision and where we might end up as you look forward 20 or 30 years. And what is the result of this document if successfully implemented? So in our vision statement we did, and this was only after consultation with the experts, we do have language in the document talking about equitable food and other issues too related to public health. So we do have at that earliest level of the document the reference and the incorporation of the idea and the concept into our vision statement. And then as we take that to the next level, like any comprehensive plan, we have goals and objectives. And as the topic may affect land use, economic development, parks and recreation, community facilities, you do see then that vision statement boiled down into the next level of detail, which is the goals and the objectives. And then third, you see that in the text of the document itself, the reason why I incorporated this page, you do see more specific reference to the principles in the document itself. And another piece that I think is really important is to talk about as a value statement, the importance of public health and equitable distribution. So we do have that on another page. It's not one of those that I put into the presentation, but we do talk about public health as a value and the park system as a value to that and all the other principles that go into public health. So those are some of the ways that we've incorporated into the document. And like any community, you know, this is really a policy document. It's an idea. It's an opportunity to get a concept on the radar screen, and then you have to boil that down into ordinance decisions, policy decisions, or other implementation tools where you can really make these ideas come to life. But I think it's important to note that the comprehensive plan is that playbook, if you will, from a sports perspective is, you know, these are the things that we're going to try to do, and here's what everybody's role is in there. So whether it's your planning staff or it's your Parks and Recreation staff or any other department, they know that this is something that they believe in, that they should believe in, hopefully, and that, you know, this is on their to-do list, working in concert not only with city staff but with others. So that's a brief introduction to our comprehensive plan and the process that we went through and the ways that we really were fortunate to incorporate food access and public health and just some of the other, you know, topics of the day at the next level and more than just what it might be only a sentence or two in the document. But there are many examples out there, but I'd be happy to field questions from others, phone call or emails tomorrow or as we go into the future about other lessons that we've learned through the process. But with that, I'll turn it over to Adam, and we'll move on to the lessons learned in the MetroCog.
All right. Thank you, Matt, and good afternoon, everyone. Again, my name is Adam Altenburg, and from here, I'm going to talk a little bit about our efforts here in the Fargo-Moorhead area, and more specifically, the Cass Clay Food Systems Advisory Commission. But stepping back a bit, food systems issues really got their start here back in about 2010 when the Cass Clay Food Systems Initiative came about. This is as a response to the broader national good food movement, people interested in increasing access to healthy and local food, and also just more interested in knowing where food comes from and how it's grown. Initiative includes members from the University of Minnesota Extension Service, North Dakota State University, Cass County Extension Service, and you also have Fargo Cass Public Health, Clay County Public Health, and other community members involved with that. Essentially, a big piece of the good food movement is people wanting to have more personal connection to where their food is coming from, how it's grown, who grows it, how far it's traveled, and also how it's prepared. It's also a chance to get kids more familiar with all aspects of food and to continue that education down the road. But anyway, these efforts really helped Fargo's 2012 comprehensive plan, it's called GO 2030, to be the first in our region to address food systems issues, basically looking at promoting farmers markets and community gardens, and also exploring food waste composting systems as part of a policy to reduce waste. So in order to address some of these policies, systems, and environmental changes, our organization became involved in 2012 to develop a metropolitan-wide food systems plan. As a council of governments, we work on various planning projects that are multi-jurisdictional in nature, which is how we came to be involved in this work. But anyway, this document was completed in October 2013, and it was really a chance to detail existing food systems conditions, also identifying some strategies and policy considerations to improve the systems. Also provides a framework for understanding the local food system, provides some strategies, policy considerations to strengthen local food system, and also provides a framework and data points to implement and monitor continuing progress. And as the local food system matures, these data points will serve to measure the impact that we're making here in the community. As a result of the Metropolitan Food Systems Plan, a number of issues were identified. The first showing that our community has what can be considered an emerging local or good food movement, but there are some there are some inefficiencies in the distribution systems for local foods, notably capacity limitations and lack of infrastructure for smaller growers to effectively enter the market and distribute their goods to consumers. This plan also found that in most, if not all, of the jurisdictions, there's very little support or recognition in current city regulations that would support various urban agricultural measures. Also, another thing that we found is that our community has grown. As our community has grown, food insecurity has become an issue for certain populations, and we are starting to see several lower income areas where their nearest supermarket or convenience store is 2 or more miles away, which can be extremely difficult to get to if you don't have a car or if you're on a limited budget. So in order to address these and other issues, the Metropolitan Food Systems Plan identified 6 target areas, including economic development, basically helping to expand the marketplace for local producers with the notion of supporting the creation of a local food hub down the road. You also have food infrastructure, looking at establishing permanent locations for farmers markets and also increasing the food processing capacity in the region. There's also food access, which seeks to support and promote shareable food programs, develop incentives for farmers to sell to lower income individuals, which might include SNAP or WIC benefits. Outreach and education is also mentioned, looking to expand educational programs and comprehensive marketing campaigns to increase knowledge of local food benefits and availability. And then the last 2, urban agriculture, as I mentioned before, ensuring regulations and policies support local food goals. And finally, the development of an advisory commission to ensure that there is a meaningful progress, in achieving the goals and objectives of the Food Systems Plan. This chart just shows the organizational structure of the advisory commission, how each of the components fits. And as you can see, there's a food systems coordinator, and then we have the initiative, which serves as the steering committee, and also our organization, MetroCog, providing much of the practical administrative support to the commission, which in turn brings the information and potential policies back to their respective jurisdictions for further consideration. So in late 2014 and early 2015, we set out to implement one of the recommendations from the Food Systems Plan, and that is to form a Food Policy Council. And as the food system is broader than just a city or county, it was identified that there was a need to look at this from a multi-jurisdictional perspective. Before this time, much of the work that had been done had been more or less project-focused. It was basically made evident in the Food Systems Plan that in order for sustainable changes to happen, government input and participation was necessary. So, purpose of Cass Clay Food Systems Advisory Commission, the commission was formed through a joint powers agreement between the City of Fargo and Clay County back in the fall of 2014. These are the 2 jurisdictions which are responsible for public health in our area. And as you can see, we have 8 items under the purpose of the commission, first being assessing of the food system in the FM area with consideration of state and national trends, educating policymakers in the jurisdictions, providing language for policies and codes based on research, and I'll touch on this a little bit later with the blueprints that we've developed as part of our commission's work. Also supporting community wellness, cultivating partnerships that foster collaborative communication, encouraging inquiries, and that's an area that our commission has done a lot of good work on. At each of our commission meetings, we have several opportunities for members to provide public input. We also have a public input form that's online on our website, which I'll talk about a little bit later. And then the final 2, just proposing ways to improve the food system in the FM area, and then overseeing the implementation of the Food Systems Plan. So we have an 11-member commission. 6 of those members are appointed by the following cities and counties, as you can see there: Fargo, Moorhead, West Fargo, Dilworth, and then Cass County in North Dakota, Clay County in Minnesota. And then we also have 5 additional members, which are recommended by the steering committee and then appointed by the commission. are approved by the Commission. And these are individuals with specialized food systems knowledge. Our at-large members at the moment, we have a retired farmer. We also have a person who has expertise in composting and waste. We have an individual who works at a food bank, and we also have several others that, with food service expertise. So progress to date, we had our first Commission meeting in March of 2015, and we've met every other month since then. Very early on, urban agriculture was identified as a priority issue within the metropolitan food system, and this was identified by both the steering committee and the Commission. In June 2015, we did conduct an online survey to prioritize urban agriculture issues. Through the survey, community gardens was identified as the most important issue to FM area residents. And from then on, we've developed 4 policy blueprints, and these have been discussed and approved by our Commission. These blueprints basically they address current gaps and needs with regard to the food systems issues in our area, includes an evaluation framework which notes various benefits and concerns for each issue, as well as examples of best practices from policies and ordinances used in different communities in Minnesota and North Dakota, as well as throughout the country. So the 4 that have been approved are community gardens, urban bees, urban chickens, and backyard composting. And we are looking to approve and discuss 2 additional blueprints at our upcoming meeting in July. One will be on season extenders, and then we'll also be discussing farmers markets at that meeting. So as we've expanded our efforts, we felt it's important to see what else is going on in Minnesota, and also to talk about what we've been doing up here in our region. With that, several of us have attended MPAN meetings in the cities, and at one of those meetings we were able to join Homegrown Minneapolis and the St. Paul Ramsey County Food and Nutrition Commission to talk about what each of our food policy councils are doing. We've also had the opportunity to speak at the American Planning Association, the pre-convention last year, and this year we will have a panel discussion during the regular session, which we are excited about. We've also spoken at several events hosted by Partnership for Health. This is a collaboration of community and public health partners covering 4 counties here in western Minnesota. Also held a meeting with several months back with planners from each of the 6 major jurisdictions in our area to better inform them of the work that we've been doing, and also to hear back from them to see what they're hearing basically with regard to different food systems issues. And finally, an exciting opportunity for us was to help be part of the advisory committee for the Minnesota Food Access Planning Guide, which will be an important component for future comprehensive plans here in Minnesota. So looking ahead to the future, I would say our #1 priority is promoting the blueprint documents that we've created into actionable policies in the Fargo-Moorhead area. With that, we're also looking to move beyond urban agriculture to address other issues in the Metropolitan Food System Plan, looking at possibly food access or economic development as our next topic of focus. And also looking to integrate the work from the Minnesota Food Charter and the Food Access Planning Guide and future comprehensive plans. Our organization is slated to update the comprehensive plan for Clay County here in the next year, so this will be a good chance for us to use the Food Access Planning Guide with that comprehensive plan. We also do comprehensive plan updates for other smaller jurisdictions in our area, so that will be a good thing to do. And with that, I forgot to mention this, but if you are interested, we do have a website. It's letseatlocal.org. Also, for more information, you can also visit our website for the Fargo-Moorhead Metropolitan Council of Governments. And with that, I think I'll pass it back over to Nadia for questions or comments.
Thank you so much, Matt and Adam. I think you gave us some really powerful examples and some great concrete ideas of different approaches that local government can take to integrate healthy food policy into the planning processes. Again, I just want to take a minute, if you have questions, to remind you to please submit them in the Q&A area. And while you're thinking of your questions or writing them down, I'm going to take another couple minutes to just talk about what else is available accompanying the Food Access Planning Guide before we go to questions, because there's more. So over the course of the next several months, we will be offering a series of webinars, presentations at conferences, and other kinds of technical assistance that focus on the planning community and on the community food advocates who are passionate about equity and food access in their community. Many people around the state have subscribed to listservs, they follow on social media, you receive newsletters, and you attend meetings around these topics. So you will be hearing a lot more about the Food Access Planning Guide through all of these outlets. And if you would like to use the Food Access Planning Guide as an interactive tool, we have a couple of additional resources that we have talked about less than the Food Access Planning Guide, but we also have an accompanying Food Access Planning Guide toolkit that I think all of you will be really excited about because it is designed to help you take the Food Access Planning Toolkit on the road to your own communities with the assistance of us here to help you along the way. So let's talk a little bit about this toolkit. The toolkit includes discussion guides. It includes a sample meeting agenda for what you might put together for a meeting that you host. It includes a slide deck with samples of presentation slides that some of the slides are really similar to what you've seen today. There is a facilitator's tip sheet, there is an engagement guide, and a host checklist for those of you who are working in your own communities. So this toolkit is specifically designed to help partnerships of planners and community members to identify strategies and policies that you would like to include in your comprehensive plan that reflect your needs and your priorities in your own community. I'd like to add that the Food Access Planning Guide is live on the Minnesota Food Charter website. Today it is up and live, so we are launching today. And getting there is really easy. Next slide. There it is, there it is. You can get the Minnesota Food Charter Food Access Planning Guide and its Food Access Planning Guide Toolkit resources at minnesotafoodcharter.com/planning guide. And if you would like an actual printed toolkit, there's also a link for you to sign up. And then all the resources I just talked about that are in the toolkit itself to help you work through meetings and presentations and things like that are also going to be online very, very soon if they're not already yet. So I just want to, next slide please, talk about a couple of other places where you can find more information on the Minnesota Food Charter and the Food Access Planning Guide. There is a Minnesota Food Charter Facebook page. If you have not been there yet, you can like that and be the friend of the Minnesota Food Charter Facebook page. You can follow the Minnesota Food Charter on Twitter. You can sign up for a quarterly e-newsletter, and you can also share your story of how you're using the Food Access Planning Guide, because we'd like to compile stories of other communities that are using this guide. All right. So at this point, I'd like to turn it over to our question and answer period. Oh. All right. So have we opened up the lines to all the presenters? Looks like yes. We have a couple of questions coming through. Adam and Matt, this question is something that both of you could respond to. The question is, public health advocates see comprehensive planning as an important tool to help create healthier communities, but they aren't always sure how to contribute or be involved. So do you have specific suggestions on how public health advocates can work with planning departments to develop their comprehensive plans? This is specifically about healthy, public health advocates working with planners. So some of you both talked about this a little bit in your presentation. Maybe Adam, you could address this first.
Sure. I think one area where public health officials, it would be beneficial to be involved in the comprehensive plan process. Just if you could have members involved in a steering committee or a study review committee for the comprehensive plan document itself. I think they're also important in discussing issues with planning commissions or city councils, individuals that might not have as much knowledge of those types of issues.
Okay, great. Matt, do you have anything to add to that?
I do. Taking that from the, whether it's the advisory committee to the appointed officials to the elected officials, I think an early step that you really need to take on is reaching out to planning staff in your jurisdiction. I, like other planners, are generalists. You know, we're a mile wide and an inch deep in our expertise, so we may not be up to the latest best practices or even the statistics behind the issue. So I think an early step is once you hear that the community is starting off its comprehensive plan process is to just make a call to City Hall and ask for a half-an-hour meeting to share the story. And then as part of that, as Adam said, you know, ask if you can participate in a more formal way on a committee or on a task force, or at least understand when the public hearings are coming up.
Great, thank you. This is a second part to that question. Is there any specific data that you found really helpful or information that public health or other advocates could provide that can help planners better understand the needs in their community?
Well, I guess I would start early in that process and give the statistics. I like, in particular, the one page from the guide where it has the boiled down statistics to a couple of very simple graphics. Because when you start the comprehensive plan process, you got experts in any number of topics really trying to get their foot in the door, if you will. So I think having a short, concise message that's fact-based is good. And then to have the toolkit is another great resource, because it may be that cities are already doing some of those things. So I think it's really, the guide is useful in having both the front-end information and the back-end information.
Awesome, thank you. Another question that has come through, can you talk a little bit about lessons learned from your community engagement processes? What worked? What successes did you see? What challenges did you have? And maybe, Matt, you could start that out.
Well, I think one of the challenges for us was we didn't get in early enough into the list building. You know, any good comprehensive plan starts with a community survey that you might have 100 or 1,000 respondents that, you know, we just didn't have it on the forefront early enough. Fortunately, as we started rolling after that, or we got through midway in the process, the topic came up and we were able to get it in the document. But I think, you know, it's really just a challenge to get it out there in step one of the process.
Awesome. Adam, do you have anything to add?
I don't at this time.
Okay. Well, the next question, Adam, is for you. Okay. Why did you choose urban agriculture as the first issue to address in your Metropolitan Food Systems Plan? Can you talk a little bit about that?
Sure. Well, again, we did try to prioritize these issues early on. I believe it was at our second commission meeting when we were discussing what we wanted to pursue first. And urban agriculture, as I stated before, really isn't addressed in any of our jurisdictions, and it was thought that this would be something that, if we were to move forward with that, it's something that could be an early success to kind of help with future endeavors down the road.
Great. Matt, would you like to add anything to that? About urban agriculture?
No, I think that's a great response.
Okay, great. Another question, and Adam, you might want to address how you are addressing pollinators, because it sounds like this is related to urban agriculture too. The question is, I'm curious to learn more about the pollinator section of the planning guide. What tools and messages are available to communicate with elected officials who may see community beekeeping as a liability? Have either of you addressed that issue specifically?
Urban Bees was a blueprint that we did develop early on, and it was an issue that was brought up to one of our jurisdictions that, with the hopes of including some sort of language that could be implemented into a policy to allow for urban beekeeping. Unfortunately, that didn't have the support of the majority of the city council at that time. But I do believe it's an issue that's going to be revisited in another of our jurisdictions. So I think it's a very important issue. I think it's a very vital issue that should be addressed.
Yeah, at St. Cloud we do have a couple of local strong advocates on the topic, and they've really introduced at the city level, the benefits of that, and we've changed some of our city operations. Fortunately, we already had some of the policies changed to make sure we're consistent with those principles. But now those local advocates are really trying to reach into neighborhoods, which is an interesting move, given that we have a number of organized neighborhoods that can really take a leadership role outside of the regulatory tool to advocate for neighborhood change.
Great, that's really helpful to hear. I'd like to also suggest that those of you who are interested in pollinators look carefully at the guide, because I think that will also help answer that question. There's a really nice overview that talks about the importance for pollinators and makes the case for why addressing pollinator health is important in comprehensive plans. There are 2 policy language statements and a couple of different resources that you can look at that are referenced in the Food Access Planning Guide itself. So the guide itself should help answer that question as well. The next question is a wide-ranging question. Matt, Adam, whoever wants to field this one. There is a range of planning approaches across the state, and some planners are more comfortable with new approaches than others. Do you have suggestions about how to work with planners who may be more reluctant to address food and comprehensive planning for a number of reasons, maybe because it's not traditional? Matt,
well, I know in St. Cloud, we encourage folks to simply make a phone call and set up a meeting with city staff. We're accessible, and we want to have those discussions. So, it's always just one-on-one, word of mouth to inform, and if nothing else, to gain an understanding of both sides of the issue, and from there, really try to work it through some respectful discussion.
And that's actually the same thing that we've heard when we had our meeting with the area planners a couple months back, is basically those one-on-one discussions are really important, either with the planners or with elected officials in moving issues forward.
Do you have any suggestions for, we talked about data a little bit already, but any kinds of preparation that people can do to prepare for those kinds of meetings and those kinds of interactions where they're trying to make the case? Just as a
well, as I made an argument for brevity, I think I would make the same as you're approaching your city staff. If there's a handout that they can take away. Most of us want to be thoughtful in giving you answers. We may need to learn a bit at the start of that discussion. So as you talk about learning and acting as the first 2 steps, I think as you approach city staff, you may have to set meeting 1 to educate, and meeting 2 then to hopefully discuss action if appropriate.
Great. Do you have anything to add, Adam?
No, I just, I'd say, if you have like some sort of pamphlet or a 1-page informational sheet that explains the issues, that would be important to have.
Great, great. Matt, I'm wondering if you could talk about the next steps that you're taking in your plan, maybe how you will use your plan from this point forward and the next steps for where you are in your process. and possibly the impact of the plan on your ordinances or internal policies.
Yeah, and one of the things that we found through our review process was that our comprehensive plan and our policies already were doing a good job on many topics and the tools that are suggested, but there are, maybe some shortcomings, maybe not in the ordinances, but just in our geography. So working with CenterCare and the data that they have and their existing efforts to get local stakeholders involved in the idea of some of the food access issues that we have on the east side or the west side or the south side, we're really taking it down to, land use planning block by block, because we do have some shortcomings in particular areas. So that's not really an ordinance, it's not a policy, it's just jumping right to the details of how do you solve that area problem.
Great. And Adam, can you talk about kind of where you're at and your next steps and how you're using your plan, or where you're at in your process too?
Well, as I mentioned, we're continuing on with these blueprints, and it is our hope that that one or several of the jurisdictions will there'll come a point where they'll see the need to start to look at these issues more closely. I mean, we've kind of gone back and forth. I think initially we were thinking that it would be great if we could kind of do this like multi-jurisdictional all at one time, but we have realized that it's probably better just to go city by city or county by county whenever they're ready to move forward with some of the urban ag issues that we've researched.
Awesome. Adam, someone has asked, can you share the policy blueprints, or are they available online?
They are available. If you go to that let'seatlocal.org website, the blueprints that have been approved are on that website for you to download.
Great, great, thank you. Next question, can you talk a little bit about the value that you have found from a city or municipal perspective about engaging organizations that align with this work? How have you partnered with organizations, nonprofits, and whatnot to reach out and engage them as local experts?
Well, one of the greatest advantages is the opportunity to not only share information, but to share resources. There are agencies out there that can help you. Like I said, we're working on some pretty boots on the ground kind of recommendations and problem solving, and it's not always easy to put those kinds of priorities into a budget. And if you can bring in some outside resources that, to be honest, I just don't keep track of on a daily basis, I think that's one of the greatest opportunities and reasons why a local government staff person should really get on board and try to reach out and sit down.
Awesome. Do you have anything else to add?
I know with the Commission's work, we've tried to reach out to a number of individuals that are involved in different various food systems issues in our area. At our next Commission meeting, we're actually going to we've invited all the members who organize farmers markets in the areas to come and talk about the work that they're doing. So it's
wonderful, wonderful. I think we have gone through all of the questions that we have. If anybody has any final questions, please submit them so we can get our guests to answer them, or if you have any questions specifically about the Food Access Planning Guide and Food Access Planning Guide Toolkit, we can also field those. Matt and Adam, I want to ask you one question, maybe final question if we don't see anything else come through. If you have any final words of wisdom for community advocates and planners that are perhaps not as far along in the process as you are, final words of wisdom, and maybe Adam, you can start.
I guess I would say just kind of take it one step at a time. I know that there's the tendency to want to kind of start big, but that may not always be the best approach. But if you can if you can start small and kind of build upon those successes moving forward, I think that will help achieve your overall end goals.
Awesome. Thank you, Matt. Do you have final words of wisdom?
Yeah, my advice is to really use the documents that are available, to use the guide and the toolkit and everything that you went through in the early part of the presentation. Those are the kinds of materials that are really meaningful. They're well written, they're brief, and it's something an elected official, appointed, or a staff person can take home and really understand the issue. So take advantage of that tool.
Thank you. I want to say thank you again to you both, Matt and Adam, for sharing your process and your wisdom with us. I also want to just make another plug for the mnfoodcharter.com website, where you can find these documents and more. And I also want to talk about the links that are available from the archived webinars. If you haven't seen part 1 or part 2 of this webinar series, you can still find them archived on the website on your screen. Part 1 is the basics, Minnesota local government structure. And part 2, local community planning, navigating the connections between health and local planning efforts. So both of these continue to build the case and give really important information and helpful information to people who are working in food and health and comprehensive planning. So take a look there. This is not the last of the webinar in the series. There's actually one more. We have part 4, where we will talk about equity and engagement and building authentic relationships in the comprehensive planning process. And this webinar will talk about how planners and health advocates can really see each other as partners and build those authentic relationships, not just for the comprehensive planning process, but for beyond. So mark your calendars for that date. It is the 3rd Monday in July, July 18th, from noon to 1:30 again. So we will see you here, same time, same place, 3rd Monday. And then all of the contact information from those who have spoken today, and I especially want to thank Matt and Adam for your offers to continue to be a resource. You have so much wisdom to add. And then my contact information. And please don't hesitate to contact me if you have any questions about the Food Access Planning Guide, about the Food Access Planning Guide Toolkit, or about any assistance you might need in using either of these documents, because that is my job, to be here to help you make the most of these resources. And I am happy and excited to talk to you. So please utilize this contact information if you have any other questions that you haven't thought of. And I think with that, we don't have any more questions that have come through. So at this point, we will close. Thank you so much for everyone who is online today. Thank you for your energy and wisdom. And we will see you in about a month.